You're big on technology
Oh,
to do the job right. Elaborate on that.
It's my passion. As a matter of fact, it's a running joke when our patients come in. They're like, what do you have today? What's new? Every 6 months, you have something new that you have to show me. I go to all the conventions, and I do a lot of homework on the latest and the best in order to bring that to our patients. I think the really important technology, which I hope everyone already knows about, but in case they don't, is digital radiography. I can no longer read the little squares of x-rays that I can't alter.
Is that still being done?
That is still being done.
Really? Here in San Diego?
Oh, absolutely. I see it all the time when I get x-rays.
Ask your dentist, do you have digital?
Do you have digital? Not only is it better for diagnostic purposes, that we can change the resolution and it's on a big screen so I can see little things on a big screen, whereas I can't see little things on a little thing. In addition to that, we can have 80 to 90% less radiation.
Okay.
That's really important to me. A full set of x-rays with 90% less radiation, why wouldn't you do it? And it's more diagnostic. So I'm huge on that. Okay. The second thing I'm huge on, mostly because I'm afraid of needles, is a single tooth anesthesia. Most people's fear comes from getting numb. When you ask them, they're always telling you how the dentist came at them with a big syringe, you know. Those days are over. We use, in our office, we use single tooth anesthesia, which is a computer delivery anesthetic system. It is way, way, way more comfortable. As a matter of fact, some patients don't even know that they're getting numb until they get the sensation. They're like, oh, well, what'd you do? I'm starting to feel numb.
So I probably wouldn't even know it. If I went to your office, I probably wouldn't feel it.
You wouldn't feel it.
Wow.
It's one of my favorite technologies. The other technology is the same-day dentistry with the CEREC OmniCam.
Which is a machine
that makes the teeth, and then we have a milling unit that we can mill the teeth, and then we can custom stain and glaze it right there in the office so you don't have to come back.
These are like 100,000 plus machines, right?
Definitely the plus, yes.
Okay. All right, but it saves time. It makes better teeth, you think?
Definitely makes better crowns, and it keeps dentistry exciting, and I love what I do, and I want to continue to love what I do. Me being the technician and controlling what goes on in my patient's mouth rather than a lab technician that doesn't know my patient, that doesn't see what I see, is everything to me. Maybe I'm just controlling, but I definitely like doing it.
You were telling me wireless headphones and TVs.
Yes, our patients come in, they generally will pick a movie from the hundreds of movies that we have. They turn the massage on in the chair. If it's cold, they put the heat on in the chair. And
heated and cooled chairs?
Yeah, and they kind of just check out while we do all the work. They don't even have to keep their mouth open. I have a really cool thing that helps them. It holds everything back.
Oh, so something that helps keep their mouth open so they don't have to think
about it.
Yeah,
it's not the traditional bite block that people think about. It's called Isolite. It actually retracts everything for me down to the tooth that I'm working on.
Really?
So I don't have to hold and tug a war with their tongue or their cheek. Everything is in a perfect field of vision.
So they're watching a movie on the ceiling or in front of them?
Well, it could be anywhere, but usually on the ceiling when they're laying back.
And they've got their headphones.
That's right. And they're just having a good old time. And while the crown is being milled and stained and glazed, we usually turn off the lights, give them a blanket, and say good night. We'll see you in 20 minutes. And I've literally heard some snores coming out of those rooms. So
you've really gone out of your way to make it a different kind of an experience, because nobody likes going to the dentist, but you claim they like going to you.
I want to change that. It's my mission to change the image of dentistry, because it no longer is what it used to be, or at least it doesn't have to be, because we have so many amazing things available now.